Hello, Namaste. This is Dr. Satyendra Katewa. I'm a pediatric hematologist, oncologist, and bone marrow transplant physician. I work for SHALBY Sanar International Hospital, Gurugram, Delhi, NCR region. Guys, I want to talk about the Fanconi anemia or the Fanconi anemia-like diseases and their cure. Now, Fanconi anemia is a genetic disease. It's an inherited bone marrow failure syndrome, which means sometimes the bone marrow can fail. But please understand, Fanconi anemia has got other problem as well. So basically, Fanconi anemia is a genetic disorder in which the cell repair is defective, which means in the different part of the body, cells keep on getting the defect and they can't be repaired. In a normal person, you repair it. Body has a system to repair it. But in Fanconi or the inherited bone marrow failure diseases, it is not there. So slowly that defective repair makes the cells weak and ultimately they die. So Fanconi anemia, one aspect is a bone marrow failure, but the other aspect is it can have blood cancer, it can have head and neck cancer at the age of 40. So, but bone marrow, that's at some time, those cancer. Bone marrow failure means you need the treatment now. But why we are talking about Fanconi or DKC? Why? Because these transplants are very sophisticated transplant. You need to give very minimal chemo to wipe out the bone marrow of the patient and then to put in a new system. And even the new system has to be, the best results are reported with a T depleted bone marrow transplant. Now T depletion in 50% match, yes, that's an easy thing to do but I will suggest you that even if you have a 100% match brother or sister available, and if you can give a T deplete transplant to the Fanconi patients, it will have better outcome. Why? Because any Fanconi patient getting an allogenic transplant, and if that patient develops graft versus host disease, it's a complication of transplant, GVHD, that patients, there is 95% chance will die over the next 2 years. So one thing is doing a transplant, allogenic transplant in Fanconi, but the other thing is you do it in a way so that patient doesn't have GVHD. But please remember, even if we have done the transplant, we have cured the bone marrow failure, still the other problems of Fanconi like the blood cancer, the head and neck cancer, the myelodysplasia, they can still happen at a later age. We haven't fixed it. So I hope now you understand Fanconi better than what you understood it before. And if there is any problem, kindly let us know. If we can be of any help, we will help you out. Have a great day. Thank you.